See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist Shauna Butler.
The drive to create organized, skilled care within our societies is a fundamental human impulse. Nurses are just as key, if not more key, to outcomes overall than anyone else in the healthcare team.
This outbreak almost caused the U.S. to lose its measles-free status. So this was the impetus and the start of trying to give people accurate and reliable information that they could access.
So my research really is with agricultural workers, looking to see how heat affects their health. But we're also trying to balance finding ways to protect workers from heat-related illness symptoms.
As nurses, we're taught how to take complex scientific information and break it down into really easily digestible pieces that the public can understand. And our elected officials are just the public. And so as part of my job with the Alliance of Nurses for Healthy Environments, we bring nurses to Capitol Hill very frequently.
All of the years that I have worked in public health and maternal child health has helped inform the work that I do today in advancing the next generation of nurses and healthcare professionals.
As long as we underestimate the insight and the expertise of nurses, we are going to continue to struggle to find well-being.
Welcome to See You Now. I'm Shauna Butler. Every year, May 12th marks International Nurses Day, a moment of recognition for the 27 million women and men who make up the global nursing and midwifery workforce, half of the global health workforce. In 2023, Our Nurses, Our Future is the global campaign focused on what's required to address global health challenges and improve health for all, including the World Health Organization's projection that the world will need an additional 9 million nurses and midwives by the year 2030. That's just a few short years from now. So why May 12th? Well, it's the birth anniversary of the world's best-known nurse, Florence Nightingale, and the story of a nurse and nursing's power to change our world. But there are so many nurses and so many stories that the world doesn't know. Ones that have also led to profound advances in health, safety, and the well-being for generations of people across the world. Fortunately, that's about to change with the release of an important new book that's a sweeping cultural and political history of nursing from the Stone Age to the present. Taking Care, the story of nursing and its power to change our world, written by journalist and critically acclaimed author Sarah DiGregorio, combines history and storytelling with nuanced reporting to pay homage to the profession, chronicle the power of nursing to create a healthier, more just world, and make an urgent call for change in how we value and harness nursing expertise. As part of the American Nurses Association celebration of National Nurses Month, See You Now had the opportunity to chat with Sarah about Taking Care, meet some of the nurses she writes about, and hear her thoughts on what the public needs to know to better understand and value the nurses of yesterday, today, and tomorrow.
So Sarah, welcome and congratulations. This is so exciting.
Thank you for having me today. I'm so pleased to be here. It's an honor for me.
The story of nursing, it's complicated. It's woven into war, plague, religion, the economy, racism, social justice movements, and all of our lives. You've chronicled the lives of the nurses that we should know, those past, those present, those who are actively improving lives in communities across the world. Why does the world need this book?
I think the world needs this book because as long as the general public does have an impoverished understanding of nursing, as long as we underestimate the insight and the expertise of nurses, we are going to continue to struggle to find well-being. And I really believe that. And I'm a person who has needed care. My family has needed care. And I had questions, so many questions. And I think so many people feel very lost when they need healthcare. And so the book really was my process of trying to understand what is nursing? What is this vast scope of nursing? And what are we leaving on the table as a society when we don't elevate nursing knowledge and expertise?
The title of your book, Taking Care, The Story of Nursing and Its Power to Change Our World. The title says so much. It is really bold. I think that the introduction is so powerful. So I'd love for you to read a passage of that for us.
Oh, thank you so much for saying that, Shauna. I would be happy to. This is the end of the introduction. Nursing is, and always has been, both uncommonly complicated and uncommonly powerful. In considering nursing of the past and present, there are irreconcilable tensions in how nursing is defined as a biological science and as hands-on caring, as professional and as domestic, as skills and as relationships, as knowing in the mind and knowing in the body. I think all of these can be true, and that these complications are part of nursing's power. This book is a love letter to nursing's vast possibilities. I have been on the receiving end of nursing care so expert and compassionate that it altered my life. I know that this kind of care is possible and that it should be possible for all of us. So my purpose here is not to represent all of nursing, that would be impossible, but to argue for the inherent power of ethical nursing to recognize and address problems, to create a better and more just world, and to alleviate suffering. I want both nurses and non-nurses to understand that nurses have changed the world and continue to do so. The strengths of nursing, when traced from the past into the present, they have deep and urgent relevance to the problems confronting us right now. We are facing an escalating crisis of caring in many domains. Even problems outside the obvious realm of healthcare, climate change, policy leadership, the built environment, loss of community, have huge impacts on human health. Nurses see the symptoms of these problems written on their patients' bodies. As we face these interrelated crises, which all come back to the absolute urgency of caring for one another, all of us need to understand nursing's power to see and to act. Many of the nurses in this book are using their unique insight to tackle today's problems. We ignore their expertise at our own peril. What if we all recognized how false hierarchies have suppressed nursing knowledge, only making it harder for us to get the care we need? What if telling different stories about nursing changed the way our society valued nursing expertise? And what would it look like if more great nurses used their hard-won insights to lead? If they had the budgets, the authority, and the safety to do that work? A world like that might be a more caring, healthier place for everyone.
So you have needed care. You mentioned that you have been navigating the healthcare system all your life. That began at birth. You have needed care. You were born prematurely?
That's right. I was born prematurely at around 32 weeks. That's how I started my life, in a NICU. And both of my parents were quite ill when I was young. I'm an only child. My mother was diagnosed with breast cancer when I was 6. My father struggled with substance use disorder and Crohn's disease all his life, and both of my parents died relatively young. So I really did grow up needing to navigate the American healthcare system and feeling very lost in that, feeling really lost, having lots and lots of questions. And, the way I think about it now, that sort of experience of wanting my most beloved people to get the care that they needed really felt like being in a labyrinth. And it felt like being kind of like a supplicant, like being like, just trying so hard to get this physician to talk to that physician, trying to make sure the pharmacy got the right prescription. And, I think that's a lot of people's experiences, that people feel really, really lost in a very fragmented healthcare system that we have. And a lot of my questions as a journalist come out of those experiences, whether I foreground them or not. When I'm writing, I do know what it's like to need care and to struggle to get it. And I also know what it's like when you do get care that you need, when someone sees you and hears you and is able to help you. It's profound. It's really profound. And that's really where this book came from for me.
So there is a rich history, and each one of these chapters in these domains go really, really, really deep into that history, starting out with the origins, the identity. So a really good grounding, but then still the journalistic lens, the personal narrative woven through, and then the stories of modern day nurses, contemporary nurses, weaving all those things together. You do such a beautiful job of helping to see those threads throughout time, how they're woven together to create this beautiful tapestry of the story of nursing. And one of the places that you start, and I think it's really potent and top of mind right now, is the role of nurses in the community and the many dimensions of the community. One of the incredible stories that you've shared about nurses in the community is with Tobi Ash, who we have with us here today. So I'd love for Tobi to join us. And Sarah, since you've done this interview and you've written this profile of Tobi, I'd love for you to introduce her and set the context.
Thank you. What an honor for me to introduce Tobi Ash. I came across Tobi's work through a neighbor who is a librarian who really wanted to tell me about this incredible group called the MS Initiative. It's a group of nurses who are reaching the Orthodox community in Brooklyn and in the wider New York City metro area. Tobi is a nurse who specializes in women's and children's health. She's also a writer and an educator, and she has written a book called PIE. PIE stands for Parents Informed and Educated, and this is a book that Tobi created and wrote to reach young mothers in the Orthodox Jewish community who had questions about vaccination. So welcome, Tobi.
I am so happy to be with you here today.
So I was really lucky to be able to talk to Tobi about her work in the Orthodox Jewish community in terms of the measles epidemic that happened several years ago. People often say to me, nurses notice things. Nurses are the first ones to notice a problem. But you can't notice a problem if you're not tied into the community. You will not know what the problem is if you don't really know people. And so I want to ask Tobi, can you just talk a little bit about what you noticed? What caused your alarm at first in terms of when you saw the rates of measles in the Orthodox Jewish community here in New York a couple of years ago? Can you describe how you came to know that and what you did?
Sure. I'm very interested in public health. When I was a little girl, my first idol was Jane Addams and Lillian Wald. So I guess I was primed since I was 6 years old to follow in their footsteps. I'm always interested in what's happening in the ultra-Orthodox Jewish community. I was born into that community, but I split my time between New York and Florida. I've lived in Florida for a very long time. And so when I heard that there were a few cases of measles, this alarmed me. It was right after the Jewish high holidays, the Jewish New Year. And I know that a lot of people travel to Israel or to Ukraine. I'd been following the statistics that there were higher rates of measles in Ukraine. I got worried and I got scared. And the reason I got so worried about it is because the ultra-Orthodox Jewish way of life is very family-centered. Everybody kind of lives with each other. They do things together constantly, and they're extremely mobile. For example, I live in Florida, but I travel to New York so frequently. So these types of things started to worry me. And it wasn't just me. It was a concerted effort with a group of like-minded nurses. And we discovered that there was now a subset of very vaccine hesitant families in these communities. We didn't know that they had been targeted by, I would say, very notorious anti-vaxxers. And this was frightening to me because one of the loosely adapted determinants of health that I find fascinating is access. And by access, I mean education, and education in science and how our bodies work, which may be missing in some of these communities, and certainly literacy, and also access to healthcare professionals, how you navigate complex social situations, how you're going to get some basic things. So all of this was running through my head. And of course, children develop measles. And this outbreak almost caused the US to lose its measles-free status. So this really, really motivated me and a group of people to do something about it.
And when you were looking at those case numbers, what did it tell you about vaccination in that community?
It's so painful to me because I feel so lucky and blessed to live in a world where I never had the measles and nobody I knew had it. We didn't have polio. We didn't have any of these things. So I was stunned. I kept thinking to myself, why were these people targeted by the anti-vax movement? And I realized it was because they didn't have health fluency and health literacy. And so part of the work is to give them the tools. If you don't know your options, you don't have any. And at that moment, they really didn't have education on how the immune system works and how people lived just even 100 years prior to the invention. Even polio, some of their parents had polio, and it blew me away. So this was the impetus and the start of trying to just give people accurate and reliable information in an easy to understand manner that they could access.
At what point did you realize that knowing your community was the most key thing that you could do to build trust and to help them navigate?
So when I first started working in the hospital decades ago, even then they asked on the employment questionnaire if you spoke a different language. Mm-hmm. And the reason is because in most hospitals, they want as many employees and staff members as possible to speak different languages to be able to interpret for patients. And that's the whole concept. At the most emotionally charged moments of your life, even if you have fluency in a second language, you really want like your mother tongue to help you navigate very complex ideas. And as I said, like an emotionally charged situation. So what helps a lot in something that is as important as healthcare is to have a representative of the community, somebody that looks like you or talks like you or thinks like you or is from that place to build trust. Because at those times in your life, when an outsider comes to you, it can be very threatening or off-putting. And you're just so much more comfortable with somebody that you know and somebody that you're close to and that you can have an easy rapport with. You don't have to explain certain things because they get you, because they are you. And that, I think, helped enormously because they trusted me. They felt that I wasn't going to lie to them and that everything that I was telling them was because I love them, or even if I didn't know them well, that I meant them well.
And Sarah, how does it help to know that nurses are there to help navigate health systems?
What I hear a lot from people when I ask them, what was it like for you when you were in the hospital? What was it like for you when you were making this decision for your children? A lot of it is about feeling confused and feeling like, I don't know who's talking to who. I don't know what people's motivations are. And when the public understands that nurses are there to know not just how your pancreas is functioning. Of course, this is all something that nurses do biomedical work, but you cannot understand someone's health without understanding what their life is like. As Tobi is saying, what do you have access to within your life, your family, your community, your values? What's your living situation like? And so to me, what's so powerful about what Tobi is describing is that she comes at this with a tremendous amount of scientific understanding of how vaccines work, why they're important, what happens with measles, why vaccination against measles and other illnesses is necessary. But she isn't just stopping there. She's understanding, what is the educational system like in this community? What kinds of messages are they getting from different kinds of prominent people in the community? What are their worries? And you cannot address someone's health without knowing those things.
So one of the things in the organization of how you've written Taking Care, you again start with this domain of community. And community has so many different dimensions. Oftentimes people go immediately to geography, that it's a zip code or it's an address, when actually communities represent identities, abilities, stages of life, diagnoses, interests, your circumstances. And so another beautiful way of demonstrating knowing your community, caring for your community, researching your community is the story and the work of nurse researcher Roxana Chicas. And we're so thrilled that she's here.
Yes, I was very excited when I first heard about Roxana's work. I think I first read about her in the Atlanta Journal-Constitution. I had been thinking about that same idea of understanding someone's health in a holistic way. And I was thinking about different environmental inputs. And I was thinking about climate change and the ways that increasing heat is impacting lots of communities. And when I heard about Roxana's work with farm workers in Florida, that was incredibly important that people know about this. So Roxana is an assistant professor at the Woodruff School of Nursing at Emory. She is also an investigator on some very extraordinary community-based research that she does in collaboration with the Farm Worker Association of Florida. Many of us have on our radar this idea that when there are heat waves in the summer, sometimes you see headlines about farm workers collapsing from the heat. And these are really terrible stories. And one of the reasons that happens is because farm workers are often working in completely unregulated and exploitative working conditions where they are not guaranteed access to water or rest or shade, which are things that they need to stay safe in the heat. And so what Roxana is doing is she's working directly with the community of farm workers in Florida to find out how the heat is impacting their health, and also to put tools directly into their hands that can help them stay safe. So Roxana, do you want to speak a little bit about the different research that you have been doing with this community?
Yes. First, I want to thank you, Sarah, for highlighting the work that we are doing and for writing this book. While you were reading the excerpt from your book, I started thinking, wow, I really am proud of being a nurse because it's so beautiful the way that you write about our profession. And I really hope that this book pushes us forward as a profession and start influencing a lot of the things that are happening in our country and the world. And also for people to recognize, to have an awareness of how powerful the nursing profession can be. But yes, so my research really is with agricultural workers, looking to see how heat affects their health. And we do this with the Farm Workers Association of Florida, because I think that anytime you do community engaged work, the gold standard should be that you should partner with an organization who has built a rapport with the community, has their trust, and also their best interests, who can direct us researchers in, making sure that we are doing ethical research that's not burdensome to the community and that it's really meaningful to the community. And so, for example, when we were thinking about doing research in Florida with agricultural workers, we thought that we were going to do research on pesticides. And it turned out that the community was not interested in pesticides. And this was back like 12 years ago. They were interested in how heat was affecting their health because they were exposed to the heat and they felt different. Like they could feel that the heat was increasing. And they said to us, it has to impact us. How is it impacting us? Communities really know what's going on, and we as researchers should listen to the communities to find out what it is that they're worried about so that we can provide meaningful results in the research that we do. And so that was 12 years ago, and we're still researching what heat does, but we're also trying to balance finding ways to protect workers from heat-related illness symptoms. So we feel that we can do both at the same time, right? We can investigate what's happening, but also find ways to protect workers. And there are ways to protect workers. This notion that that's just the way the environment is, this is just hard work, it's harsh work, and you have to accept it, is not true. We can protect workers. There are ways to do it, and we need to do studies to find those ways and hopefully to get growers to embrace methods to protect workers and also to influence policies. Like you said, there aren't any federal heat protection standards for outdoor workers. And with climate change and the intensity of heat waves, it's becoming more and more of a problem. So I'm hopeful that some of the research that we're doing will influence policy, will influence growers to really start working together to stop workers from getting sick, to protect these workers, because all of us benefit from their labor every single day that we eat. And it's important that we start taking care of them. Nursing is not just at the bedside. There's a lot of things that nurses do outside of the bedside to protect different communities.
I'm glad you used that word community to have a closing exclamation point on that. You are a part of this community. There's a very clear and specific reason why the community of migrant farm workers trust you. You know their lived experience. And I'd love for you to just say a little bit more about your own lived experience with you, your family, why you can be that trusted researcher.
I'm from El Salvador. I immigrated to the United States when I was 4 years old with my mom. I was undocumented until I was 18 years old. And then I got temporary protected status, which gave me the ability to have a social security number and to be able to work. So I understand what it feels to be undocumented and to want to work and not really cause any trouble. The goal, my mom would always tell me, was get a job, get a good job so that you always have a job and your boss always loves you, right? And keeps you working. A lot of agricultural workers, that is their goal. They want to be employed because they want to provide for their families. And that's why they take on these very harsh jobs that are low wages, because oftentimes that's the only thing that they have access to. And so I felt that, I had the opportunity to study here because of great mentors who kind of guided me into higher education. And I thought that it was important that I give back to my community, that I was giving this platform where I could perhaps influence policy or how research is done. And as a nurse, researcher, we can be out there in the community and do a lot of the biological collection. We can also give health education and do science. And it's really important for us that when we go and do data collection, that we not just take data with us and then, analyze it. But we also really try to put in other measures that the community is eager to have, such as measuring their cholesterol, their A1C, their kidney function, their hydration status, because they're hungry for it, because they don't have access to healthcare like many of us do. And I totally understand that.
Roxana, you represent this really beautiful intersection of community, advocacy, research, health justice, social justice, and specifically the research being able to inform policy. And speaking of community, we might in some terms think of the planet as community. Policy is care, nursing the system. And in the way, Sarah, that you've organized the book, you've got this lovely chapter, environment. And I love the subtitle, Seeing the Future, Nursing in a Swiftly Changing Climate. And I think about the multiple meanings of climate, the Earth's climate, our political climate, and opening that story up with Hurricane Sandy and this incredible story of hospitals having to evacuate little tiny babies, and this coordination and effort that was forced upon our healthcare systems and particularly nurses to respond to this because of this rapidly changing environment. Incredible stories that you share there. And one of them is with Katie Huffling. She's nursing at the system level and helping us to understand why it's so important for nurses to be policy experts and policy advocates. So love to welcome Katie in. And since you've gotten to know her, Sarah, and written about her story, why don't you go ahead and introduce her?
It's wonderful. Katie Huffling is a certified nurse midwife, and she is the executive director of the Alliance of Nurses for Healthy Environments. And I loved what you said, Sean, about nursing the system, because one of the things I did really want to make a point of was to describe how nursing can operate on so many different levels, and the system does need to be nursed. So Katie described to me how she brings nurses to Washington, D.C. to speak with lawmakers about what they are seeing and noticing, and then what they think the solution should be. So, Katie, can you tell us just a little bit about the messages you're bringing to lawmakers? What are the things that you really need lawmakers to hear from nurses right now in terms of planetary health?
Thank you so much. I'm just so proud to be a nurse. And there are so many different ways that you can be a nurse. And so, as part of my job with the Alliance of Nurses for Healthy Environments, we bring nurses to Capitol Hill very frequently. And nurses are just incredible messengers. As part of our nursing practice and as our training, we're taught how to take complex scientific information and break it down into really easily digestible pieces that the public can understand. And our elected officials are just the public, and so we can take an incredibly powerful mix of that scientific information and then providing the stories of our patients and the things that we're seeing in our communities and having that personal story. It's just incredibly powerful. For example, a pediatric nurse can come in and talk to their elected official about taking care of children struggling to breathe because they're being exposed to air pollution that's caused by climate change. And, really bringing that personal story of on the ground impacts. It's really hard to say no, I think, to that type of message. One of the things that we've been really working on in the climate change space, because it can feel so overwhelming and so challenging, and there's so many different negative health impacts, is to kind of flip that messaging and really highlight the many health opportunities that we will realize if we take strong climate action now. We'll have fewer children with asthma attacks, more babies not being born premature, fewer cardiac events. There's so many positive health benefits. And so I think also raising up those positive things that we'll be seeing with strong climate action.
When you think about what is needed on climate action, the climate urgency, what are some of the things, how is that changing our practice?
Yeah, so I think there's multiple ways that nurses can incorporate climate action into their practice. One is just the education that we do with patients. There's a lot of things that patients can do themselves to help reduce health impacts related to climate change. For example, if you're taking care of pregnant patients, what do they need to be doing on a high heat day or a poor air quality day to ensure that they're able to continue having a healthy pregnancy? You can also be advocating for things related to heat if you have patients that are more vulnerable to heat, such as the very young or very old pregnant patients. Can you get insurance or Medicare, Medicaid to pay for air conditioners in their homes, and then also the electricity needed to run them? So really thinking of different ways that we can be shifting policy and payments. But then we also need nurses being leaders within their healthcare institutions. This is a huge problem, and healthcare is part of that problem. We're one of the largest greenhouse gas emitters of an industry out there. And so we really need to be looking at the energy that we're using, the materials that we're using, our healthcare waste, and as the largest portion of the healthcare workforce, if nurses aren't the leaders at the table making these decisions and changes, it's just not going to happen as effectively as it needs to.
You mentioned particularly the most vulnerable, that the health risks and these adverse events, that's who's going to see it first. That's going to be the last to recover. In 2019, the Lancet Countdown Report on Health and Climate Change, they warned, and I'm going to read this quote, "A business as usual trajectory will result in a fundamentally altered world where the life of every child born today will be profoundly affected by climate change." And to provide some insight on that and perspective, the risk to birthing people, pregnancy, infants, I want to turn to public health nurse Sherri Wilson. Sherri, you have vast experience in public health, particularly in maternal and newborn, looking at it from a population perspective. What were you seeing, and what are you recommending as far as nursing our system and thinking about planetary environmental health as far as how that's related to our human health.
Absolutely. Shauna, we do know that according to the CDC, the maternal and infant mortality statistics, Black women are 3 to 4 times more likely to die for pregnancy-related childbirth complications, and Black babies are almost 4 times as likely to die as well due to preterm birth.
As you're listening to all of these discussions, what are your thoughts as far as how we're going to protect Black women, Black babies?
Well, one of the things that is at the top of my mind is our future nursing workforce. So all of the years that I have worked in public health and maternal child health has helped inform the work that I do today in advancing the next generation of nurses and healthcare professionals. I work for an organization that was founded to make sure that students of all backgrounds have access to high quality education. And in that role, I started an online health sciences career pathway that has touched thousands of middle school and high schoolers across the country and abroad who are interested in becoming nurses and healthcare professions. And this work was informed by the global health inequity trends as it relates to income and wealth, race and ethnicity, gender, urbanization, globalization, and ultimately my lived experience as an African-American woman growing up in the most densely populated state in the United States, New Jersey, and having to navigate those educational and healthcare systemic barriers throughout those zip codes really helped to inform this pathway for young people. And so looking at the Future of Nursing 2020-2030 report, this report calls for really cultivating our future nursing workforce from a diversity perspective in order to promote health equity. And it calls for advancing and redesigning our educational system. So I am approaching it, if you will, from the front end at a student's formative educational years. And I believe that's very important as we talk about having a more culturally competent and diverse workforce.
Yeah. Our data, our evidence, research, experience, qualitative, quantitative, all of that points to when people who live like you, look like you, speak like you, eat like you, pray like you, care for you, it gets better. It gets so much better when we have a workforce that looks like the communities that we're caring for.
I also want to build on what Sherri is saying and name something, because when we talk about disparities, I think it's really important to name what we understand about the cause of the disparity is, because it can give an impression that there's something wrong with certain communities when that is not at all true and is not supported by the research. In fact, the research strongly suggests over the course of several decades now that it's exposure to racism that is the cause of the higher maternal mortality rate for Black women and for the increased prevalence of premature birth and, unfortunately, infant mortality for Black communities. So when we're talking about this, I always want to make sure to name that because it has an impact on how people understand the problem and your work, right? And so when you're talking about increasing the diversity of the workforce, because that promotes health equity, I think it's really important to point out that that's because we have a problem with racism in our medical system.
Absolutely.
And research suggests that this is where much of this problem is coming from. I also wanted to hear from you, Sherri, like you were describing working with, middle schoolers. Like, what do you hear from middle schoolers about what they think about nursing?
It's very interesting because when I came into this work, it was at the height of the pandemic. And in my mind, I was thinking, I said, this must scare future nurses or students who are thinking about becoming nurses. And to my surprise, I was just so happy to see that there's still so many young people out there that want to become nurses. And they're asking for, how do I do this? What are some ways that I can come into the profession? Listening to Tobi talk about access, I think that hits the mark. Access really, that's what separates us. It's not ability, it's access to to resources. And so this is what they were asking for, and it helped to inform, the work that I do with these health science pathways.
It's such a beautiful way to tie this conversation, because so much of this book, Taking Care, the story of nursing and its power to change our world, goes back to these stories inspiring people to say, I want to be a part of that important work. I want to take care of the people in my community. And the beauty of Taking Care is how these stories are woven through the origins, the identity, building out community. And this has just been such a wonderful conversation where we've looked at community, the dimensions of community, that community expands far beyond the zip codes that we live in to this very large community, the earth, the planet, the environment that we all share. And then going back to thinking about the most vulnerable people and how nurses are really key in taking care of the least, the last, and the lost. And when we center on them, how we truly all get healthier. Sarah, one of the things that you write about so beautifully is that there's a crisis of care. Oftentimes I hear the framing that there's a nursing shortage or that there are vacancies. But going back to some of your really important insight is that when nurses aren't there, people die. Lives are lost because it's the nursing care. It is nursing. So taking care, talk about it being a love letter to nurses. I know I felt that love, and I'm sure as people around the world read it, they're going to feel that love as well. Sarah, what do you think the take home is of Taking Care?
One thing that I think the general public may be surprised to learn first, which is very specific, which is that the better the nurse to patient ratio, the more time your nurse has to spend with you in the hospital, the more likely you are to be discharged alive. So I think that in particular is something that the general public does not understand, that nurses are just as key, if not more key, to outcomes overall than anyone else in the healthcare team. Obviously, we love physicians, and people think of physicians as the people who are really acting upon them to create health. But that is only one small part of the story. And I really wanted the general public to understand that. I think that's something that nurses probably already know. It's critical, it's life and death, and people don't know it. And so that's one thing. But on a broader level, thinking about both nurses and non-nurses, what would people be surprised to know? And what did all that digging unearth? I mean, first of all, it unearthed so many rich stories. I could have written this book for the rest of my life and not been done. But really, I think a lot of people, including nurses probably, think about nursing as a relatively recent invention, something that a profession that came about in relation to physicians and hospitals, that nurses were needed by physicians, that nurses were needed in hospitals, and that's where the profession came from. In fact, that is backwards. Nursing actually came first. Nursing was the first kind of organized healthcare. It remains the most fundamental kind of healthcare. And you can see this when you look into history. So for instance, the first known school of nursing was established about 2,000 years ago in ancient India. Ancient Indian texts theorize healthcare as having four main pillars. And the pillars are the patient, the medicine, the nurse, and the physician. And it says without those four pillars of healthcare, healthcare doesn't exist. Healthcare can't stand. And so even way back when, you see this idea that nurses are equal partners in healthcare and that they are absolutely necessary and have very specific expertise. That's a very old idea. That's not something that came about in the 1800s. It comes from all over the world. So this idea that nursing has one origin story is absolutely false. Nursing has probably uncountable origin stories. And there is a richness there that I think is incredibly powerful for nurses to know about. Because once you understand that actually the drive to create organized, skilled care within our societies is a fundamental human impulse, then you understand yourself in that line of tremendous power that goes back to our earliest ancestors. What makes us human is that we evolved to care for each other. You know, we don't have to be this like survival of the fittest, leave the weak behind. That's actually not the full truth at all. I find those long seams of power running through all of human history and culminating in these stories of nurses working today who are doing this amazing stuff. It was kind of overwhelming for me, honestly. I mean, the richness of those stories, and I get very excited to tell people about these things, that's who we are. That's how we can be. So what does that mean for us? It has policy implications. It has implications for everyone's daily life. If my neighbor is healthy, I'll be healthy. If my city is healthy, I'll be healthy. If all of those things happen, then maybe my daughter can have a healthy future. I think that it's a virtuous cycle. Thinking about and understanding what nurses do specifically in your profession, in your independent scientific discipline, can also call the rest of us to think about our societies differently and make different choices that will be healthier for everyone in the long term. That's what I really hope for this book.
I think it would be a really beautiful way to bring this to a close for this session and an invitation for more people to dive into these beautiful words and stories. If you could read a passage of that for us, and we will all sit here and feel a great sense of reverence and appreciation as you do.
Thank you so much, Shauna. I will do that. First, I just want to say the work of a journalist is like the luckiest work of all, which is to write about real life. There's a Salman Rushdie quote from The Ground Beneath Her Feet, and it goes, "The world will break your heart, but it will never fail to give forth wonders. What is required of you is your attention." And so to me, like, my work is about paying attention to what you're doing because it's a wonder. And that's what it's really about. And it's also true that the world is probably breaking all of our hearts a little bit right now, or a lot of it. Okay, so this is from Taking Care, the Story of Nursing and Its Power to Change Our World. Sooner or later, we all need to be nursed. A nurse may have been at your birth and may be at your death. Sometimes nurses are the first and last people to touch us. Nursing is a profession, an independent scientific discipline, a practice, and a way of interacting with the world. It's also an elemental public role, one that elicits deep feelings, beliefs, and anxieties in the collective imagination. I came to this meditation on nursing as a journalist, but also as someone who grew up surrounded by the illnesses of the people I loved most. Because I'm not a nurse myself, my perspective has limitations, but I would argue that nursing matters to everyone. It draws much of its power and effectiveness from the relationship between nurse and patient. It is the indispensable foundation of all healthcare. And so in that sense, nursing belongs to everyone. When I was lost in the wilds of the American healthcare system, nurses showed me and my family how to move forward. Nurses are not just there at the most profound moments in people's lives. They use their knowledge and skills to guide people through those moments.
With that, I am so grateful for my colleagues. I'm so proud of them, who they are and how they show up for one another, and for the people in the communities that they care about and care for. And I'm grateful for and excited about Sarah's book, Taking Care. Society has such an impoverished understanding of nursing science, care, and practice. Sarah's work enriches and nourishes while offering the world, and healthcare in particular, many stories and insights that have been missing and sorely needed. Special thanks to our episode guests, author and journalist Sarah DiGregorio, and nurses Tobi Ash, Roxana Chicas, Katie Huffling, and Sherri Wilson, and to the nurses and midwives across the world for their expertise, remarkable work, and commitment to communities, people, and future generations. With May being National Nurses Month, it's a moment to reflect and to appreciate nurses, but it's also a call to action and an opportunity to shift and shape the better, more accurate, more helpful narrative of nursing expertise and care, and nurses' power to improve and save lives and change our world for the better. We're excited for this book to be out in the world. This episode was produced in conjunction with the American Nurses Association National Nurses Month celebration and their special May 12th event, Nursing's Power to Change the World. You can find more information about this and other ANA events on their website at www.nursingworld.org under the Events section. Taking Care, the story of nursing and its power to change our world, is out May 2nd from Harper, and you can find more information about Sarah along with her other works, including Early, an intimate history of premature birth and what it teaches us about being human, on her website, sarahdigregorio.com. For See You Now, I'm Shauna Butler. Thanks for listening, and happy National Nurses Month.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.